Hi, and welcome to today's webinar. I am super excited to have you all joining me in today's webinar. Someone will be asking now, why are you so excited? Yeah, doctor, yeah, I'm super excited because right from the day I got tagged on that video on TikTok, even before that day, a lot of people have been tagging me on videos, ugly stories about pregnancy. Women in my community, once they see a video on people telling stories about their ugly experience in pregnancy, they'll just tag me or they just copy the post and send to my DM. And they have been telling me, Dr. Ifunanya, you need to do something, you need to talk about this, you need to create a webinar for us. Talk about this. Let a lot of people hear about what they can do to remain safe. It's very sad that a woman happily, when people get married, a lot of people, they are very happy to take in within 1 month or even on their wedding night, and then imagine how that excitement just ends because the woman was lost or the baby was lost along the way. So it's something very ugly. It's something that we shouldn't even experience. So when I saw that video of a nurse that lost her life on TikTok, that was the last. I was like, no way. We can't start this in 2024. Like January 2024, we can't do this. So I had to do this webinar to show you what actually happens during pregnancy, where the problem mostly come from my experience as a doctor, from research, and from other people's experiences. This is where the problem come from, and these are the things that I have practiced over the years to get results. When things are happening like this and there is an alternative way, a better way to do things, I think it's something that we should let other people know. And this is exactly why you are here and you are listening to me on this webinar. Okay, so make sure you stay to the end of this webinar. I'm not promising you any free thing at the end of this webinar, so let me make it clear. It's a free webinar and it's going to expose you to knowledge and, of course, alternative care that you can receive during pregnancy, but no free thing. Okay, all right. Okay, there may be a free thing, but it's not what you're thinking. Okay, all right. Today we'll be talking about 5 reasons women die during pregnancy and how to identify and prevent them. Just that. Let us know the root cause of why we are dying. Let us know the root cause of why women are dying. Once we're able to identify these causes, we'll be able to profile solution and be able to show you what you can do to remain alive. Trust me, there is no woman that wants to go into pregnancy and die. If a woman knows that she will die when she gets pregnant, she will not try that pregnancy. So we go into pregnancy because we want to come out, want to be the best mom, want to take pictures with our kids, we want to swim with our baby girl, want to, we just want to be the best mom. Nobody goes into pregnancy to die in the process or go through pregnancy and lose the pregnancy or may even lose her own life and that of the baby. It's wickedness. I call it health wickedness. People that read my posts on social media know that I've always talked about this. Okay, so let's get started. So what we are going to learn today is, from this webinar, you're going to understand what are the common things that lead to death in pregnancy. And I am going to focus my energy for the purpose of today's webinar. I am going to focus my energy on preeclampsia, hypertension in pregnancy, preeclampsia, eclampsia, everything about preeclampsia, eclampsia, and how to manage it, how to identify it even at home without hospital, without your doctor flowing you up and down, how to identify that you might likely be having preeclampsia, what you can do at home, how to move to the hospital after the hospital has reviewed you and confirmed that you have preeclampsia, what to do at home because hospital care might not be enough. So what you have to do at home to keep yourself safe, even if you have preeclampsia, to make sure that preeclampsia does not steal your baby or your own life. This is exactly why you are here. So, if at this point you feel that this is not something you want to listen to, or it does not concern you or someone that you may know, okay, we may call it a day here. But if you still feel like this is a webinar you need, even if you're not currently pregnant or you're pregnant and it could help you or help somebody you know tomorrow, then welcome to this webinar and let's get started. Before we move on, I want to, in case you're meeting me for the first time, I am Dr. Ifunanya. I'm a Nigerian, of course. And I'm a medical doctor, a wife, and a mother. I've been pregnant twice. I have a son, and I've lost one of my pregnancies. Probably, if you go to my wall on Facebook, LinkedIn, or anywhere, you're going to see the story how I lost my pregnancy and how it has pushed me to change my path. It has pushed me to do what I am currently doing today for other women out there. Okay, I'm currently pursuing a master in gender, sexual, and reproductive health in University of Global Health Equity, Rwanda. Rwanda is in East Africa. Okay, I am very passionate about simplifying pregnancy teaching. People call me Dr. Wedi Pampa because of how simplified my teachings are. Probably at the end of this webinar, you will also understand why they call me that. Currently, I am the co-founder and CEO of Preggify. Okay, you're going to learn more about Preggify as we go on. And for over a decade, or close to a decade, I've been championing maternal and child health from non-profit to currently doing it as a profit social impact. I am an on-air personality on several radio stations like ABS, Anambra Broadcasting Service, Mainland FM, City FM, Women FM Lagos State, like a whole lot of radio stations where I talk about women's health. Specifically, I talk about women's health. Okay. I told you about Preggify. So Preggify was born out of pain after I lost my pregnancy in 2022, and since then we're built on Facebook and WhatsApp over community of over 2,000 women, and personally and directly we have nurtured success and delivered successfully over 600 babies in 6 countries, including Canada, United Kingdom, Angola, Germany, um, Ghana, Niger Republic, Nigeria, and counting. In 2023 alone, we managed up to 15 cases of preeclampsia and we had 100% success in them. These are women that have lost pregnancies before and before they met us, and we made them to become mothers. Yeah, I think it's a bragging right. Okay, so let's just move on. I know you're very anxious, you're very tensed, but you know what? Before we move on, please breathe in and breathe out. If you're pregnant, please breathe in and breathe out. There are a lot of fears out there: fear of miscarriages, fear of bleeding to death, fear of hypertension, fear of having abnormal baby, fear of losing your own life. Like, you have seen stories, you have heard a lot of things, you have read a lot of things, and that fear has engulfed you. Like, you don't know whether you're going to make it, or should I go for vaginal birth? Should I go for cesarean section? Is this baby going to live till 9 months? Am I going to come out alive? Am I going to have complications? What if I go to cesarean section and die? Like, so many things you have read online, and you're like, what am I going to do? So I'm just telling you now, breathe. Okay, a lot of women have this fear in them that they are unlikely to come out from the other end alive, and I'm here to change that mindset. I'm here to tell you that those things are fallacy, they are myths. Okay, because if you go to World Health Organization website, they're going to tell you that every 2 minutes a woman dies during pregnancy or childbirth. But there's something people re- do not recognize. After that statement, they are going to tell you that these deaths are highly preventable. Do you understand? They acknowledge that people are dying. A lot of women are dying. But their death is highly preventable. 90 to 95% of what make women to lose their life in pregnancy is highly preventable. And this is something that we have experimented. This is something we have done at Preggify, and this is something we have got 100% results on. Okay, so breathe. Don't fear. Okay, let's move on. Yeah. So these are the top five causes of death in pregnancy. When you research or do anything, you see a lot of women die from excessive bleeding, some die from infection. Then some women get pregnant because they don't want to keep the pregnancy, especially young girls. They go through unsafe and illegal abortion done by quacks, and then they have complications and they die. Some women go into labor and the labor is prolonged without intervention, and some of them have this syndrome of delivery like Hebrew women. So they tend to run away from the hospital to birth homes, or they go to a hospital that is not well equipped, and then they lose their life in the process. And the chief of them all that I told you that we are going to focus on today. Why am I focusing on hypertension, preeclampsia, and eclampsia today? Is because this is the most occurring complications of pregnancy that we have encountered at Preggify. And while I was during my master's program, while I was writing most of my assignments and thesis, I find out that preeclampsia is almost topping the first leading cause of death of women in pregnancy called maternal death. And this is why I am giving more attention to it today. Subsequently, in our next webinar, or yeah, of course, in our antenatal classes, we teach about other things that other complications that can come up in pregnancy and how to identify them and how to prevent them. Okay. Before we move into preeclampsia, let us talk about hypertension in pregnancy because this is the root cause of the whole problem. Okay, remember that hypertension in pregnancy can be in two forms. One, we have pregnancy-induced hypertension. Pregnancy-induced hypertension is hypertension, increase in blood pressure that's occurred due to the pregnancy. This one is usually seen around after 20 weeks of pregnancy, that is after 5 months of pregnancy. That's when the symptoms of this one begins to manifest. But we have what we call chronic hypertension. Chronic hypertension is hypertension that a woman already had before she conceived. This woman is already hypertensive, but probably she knows or she didn't know because she was not going for regular checkup or she didn't do a preconception care before her pregnancy. So this hypertension was now discovered when she had gone for her booking test. When you go for a booking test, they check your vitals. So they will find out that, oh, this woman in her early first trimester, 12 weeks, 13 weeks, 8 weeks, her BP is already increased. And they check it over time and find that it's still increased. That is unlikely to be pregnancy-induced hypertension. In this case, this is chronic hypertension in pregnancy. There are several risk factors that can lead to whether it is chronic hypertension or pregnancy-induced hypertension. Things like obesity, like when you're overweight and you're turning towards obesity, is a risk factor. When you have a family history of people that have had hypertension, maybe your mom, your sister, or someone in your family had hypertension or they had hypertension in their pregnancy, is a risk factor that you may also develop it. When you are taking excessive intake of sodium containing sodium chloride containing food like salt, salty food, you are likely also going to have the risk factor. Now, this is a risk factor and not a cause. Okay, if you have already existing liver, sorry, kidney problem, it can lead to hypertension in pregnancy. And of course, hypertension in pregnancy is mostly a product of some miscommunication between chemical released by the placenta and your body. So because of that chemical and miscommunication, this hypertension in pregnancy occurs. Okay, I don't want to bore you with the medical pathways and everything. Okay, just know that pregnancy-induced hypertension, the one that is caused by pregnancy, is because of misfiring from the placenta, chemical that are being released that is not receptive, like body is not receptive to them, they are not the normal ones, so the body reacts to them and develop leading to hypertension. I think that's the simplest way to explain this. Is this progressive? Yes. Hypertension in pregnancy is progressive. It might start initially with mild hypertension, like above 120 to 130, 135, and before you know it, it's tending towards 140, 160. Even I've seen 200. Yeah, the woman that ran to me in 2022 when Preggify newly started, had a blood pressure of 210, 120 or so. I think 210, 110, over 110, and then her protein was 3 pluses. So, and her own came in, she had chronic hypertension, so her own preeclampsia started quite early. The pregnancy had to be terminated because it was not taken care of, and I'm going to tell you why it was not well taken care of, and she ran into complication quite early in pregnancy. Now that I've laid the foundation of what happens in hypertension, uncontrolled hypertension will eventually lead you to preeclampsia slash eclampsia. Preeclampsia is when you now have this hypertension, even though these days we'll see women without very high blood pressure still having preeclampsia, which is very normal according to recent updates in medicine, in obstetrics. Okay, so when you have your hypertension and then you do your urinalysis and you start having traces of protein or 1 plus 2 plus of protein in your urine, not caused by other things like urinary tract infection, then you'll be, with other investigations that you have to do, you will be diagnosed with preeclampsia. So this screenshot I attached here was a woman asking me on Facebook to talk about preeclampsia because she lost a colleague who was also a doctor, sadly, to preeclampsia. I am not shocked because I've personally known a junior colleague who suffered eclampsia despite being a medical doctor, and you are going to find out why these things happened. How does it start? When does it start? I've already said that this thing starts around 20 after 20 weeks of your pregnancy. That's 5 months. And how does it manifest? How dangerous can it be? See, let me show you something. Preeclampsia is very dangerous, and I'm going to show you what a woman who had preeclampsia had to say about preeclampsia. But before we go to that, let's see how preeclampsia manifests. So when you're looking for a physical sign for preeclampsia, sometimes you may not see any. Sometimes you might just be living your best life, going out, coming back, doing your work without feeling anything. So it is not abnormal for you to say that, for your doctor to diagnose you with preeclampsia without you feeling anything. But for some women, they're going to notice that, okay, their leg has still increasing in size. We call it leg swelling. And sometimes when they put their hand, they apply pressure on the swelling. It dips inside, forms a dimple, which is called pitting edema. Okay, you can see that in preeclampsia too. And then this swelling, if not taken care of early, not taking care of the swelling, the cause of the swelling, which is preeclampsia, it will increase from your foot to your leg and your hands, even your face. Everywhere will become very puffy and swollen. Okay, when the preeclampsia is not managed. All right. Sometimes some women feel headache. Why I don't want to talk so much about this, because these are non-specific symptoms. Okay, because you can actually feel very okay de- despite having preeclampsia. All right. So the best thing to do is to be very, very consistent. Have a routine that works for you in pregnancy. Some of these routines, we are going to discuss them as we go on how to identify preeclampsia at home, how to manage preeclampsia at home, and how to relate with your hospital if you have preeclampsia. These are the tests that we do when you have preeclampsia. We do a full blood count to check your blood level, your platelet count, to know whether your blood has lost its capacity to form clots, to stop bleeding. Then we do liver function tests to see whether your liver enzyme has been affected, are they normal or deranged. All these things is to show us how severe the preeclampsia is. Then we do kidney function test, which is KFT. They can call it serum lateral urea creatinine in most places. This is to show us if this preeclampsia has affected your organs. Then we do placental growth factor to show what amount of protein your placenta is secreting. Is it low? Is it high? Is an indicator to show, oh, this woman is likely going to have preeclampsia. But I'm going to say it to you. PIGF is not routinely done in Nigeria. If you're in Nigeria, you may get it in more developed countries, but it's not a routine in Nigeria. Okay. Then I put this as the last, but don't neglect this. Urinalysis. It should have been the first, but I always put the most important at the last to give me time to talk about them. Urinalysis is one simple yet underrated test in pregnancy. If you are still with me up to this point and you are underrating urinalysis in your pregnancy journey, I am telling you today that you may do away with all these other tests, but you will never do away with urinalysis. If you are going to live or die in pregnancy, urinalysis will help you to do that. And I'm going to show you how urinalysis will save your life during pregnancy. But before we do that, before you start blaming yourself, maybe you did something to your village people, maybe you committed abortion in the past. If you're in Nigeria, you know how it sounds in the ear when you talk about abortion. Maybe you sinned, maybe you did something, because that's the way some of you blame yourself. Maybe who knows whether it's one sin you committed as a teenager, who knows whether it's your ancestral curse, who knows whether it is because you didn't pray very well, that's why you're having preeclampsia. Please, it is not it. And this is why. You are not alone. These are women who come to my post on Facebook to share their story, even on Instagram. They'll tell you they had preeclampsia. This one lost 2 pregnancies to preeclampsia, miscarriages. Okay, this one said preeclampsia, is so bad. Remember when we said how bad can preeclampsia be? This one said it's preeclampsia is so bad. Okay, look at these people. There's one of them that say preeclampsia is a thief. I'm looking for it. If you read through it, you can pause this video and read through these people's experiences. Preeclampsia is a thief. Okay, is not something you want to twist. Say it's not my portion. Look at what this woman said. She said that twisting the word of God to fit their narrative, because a lot of women, when they have complications in pregnancy, they talk to the pastors. I'm a Christian, I believe in God, and I know you believe in something supernatural, but when it comes to medicine, pray, but give medicine its place, okay? And when you check this, you see that these women, they are they other people are having this preeclampsia. It's not just about you. And it's not something you can say, oh, woman A is going to have preeclampsia or woman B is going to have preeclampsia. It's not predictable from the start of the pregnancy to know who is going to develop preeclampsia. They are just risk factors like, oh, if it's your first time pregnancy, if you're having pregnancy with a new partner newly, if this and that, these things are just risk factor. You may end up not having it, and you that not even having a risk factor might end up having the preeclampsia. So don't blame yourself for anything. Pay attention on how to identify it, how to manage it, so you and your baby will have the best and superb outcome despite having preeclampsia. Okay, so what are you going to do if you are pregnant? When you are pregnant, these are the things we do at Preggify. These are what we use. We are very huge on home care. If you follow me on LinkedIn, Facebook, Instagram, or TikTok, I talk a lot about home care because as a medical doctor who has worked in clinical setting, and currently I am working as at Preggify, a health startup, it helps me to understand that there is a huge gap in the care women receive in the hospital. When a woman comes to the hospital, she books and then she's giving her next appointment to be 4 weeks. In between the time she has gone to the hospital and the time of and her next appointment, what happens? Who is caring for this woman? Who is monitoring her? What exactly is happening to her? And it is in between this period that women develop complications. And sometimes, and many times, these complications are now being diagnosed in the hospital after things has already gone bad, after complications had happened. This is why home care is our go-to strategy at Preggify. We don't joke with it. After home care, we move to lifestyle. Lifestyle is the kind of food you eat, the activities you engage in. These are the top two things we do at Preggify that have given us good results. Okay, we don't joke with it. This is why we have doctors attached to every pregnant woman on our platform to make sure that for 24 hours, 7 times in a week, these women have access to doctors they can make complaints to, that can review their home tests, that can advise them, that can follow up on them on their medication. Because these are the things that we have tried, we have tested in the past 18 months, and they are working. We didn't lose any woman between 2022 and 2023, and we're in 2024 now. We have not lost any because of what? Home care, lifestyle, and collaboration with hospital, which I put at as the third. Hospital care is good, but it is now being overrated, and I'm going to say why. Going to the hospital for antenatal care is advised. Every woman at Preggify has a hospital they are registered at, because we need this hospital for the review, we need it for follow-up, we need it for delivery, we need it for collaboration during complications. But you see, think about women that are currently working business or corporate job. How many of you guys have time to still go to the hospital for your routine test, to make complaints to your doctor? How many of you have access to a doctor 24 hours from the hospital where you're going to? How many of you have the time to go to the hospital for teachings, antenatal classes, and how many hospitals still do antenatal classes for you? In 2021, a client, when I was working in the hospital, lost her pregnancy at 38 weeks. Do you know why? Because she was busy working, she developed leg swelling, and her colleague in her workplace told her, it's nothing. It's not just leg swelling that every pregnant woman has. If this woman had had access to a platform where she can easily talk to a doctor 24/7, she would have asked the doctor and not her colleague. And by the time she came to the hospital, it was late. She was bleeding. She already had preeclampsia. Her placenta separated. The baby died. She was unconscious, but luckily she survived. She regained her consciousness on day 3 after the surgery. And that was how lucky she was. Okay, this is why home care is our go-to strategy of managing pregnancy, whether it's a low risk pregnancy or high risk pregnancy. What does our home care at Preggify entails? This is a screenshot of one of the women we managed at Preggify. I didn't want to bring a lot of screenshots because it's going to litter our presentation. Okay, look at what she said. She said, Dr. Ifunanya, I never regretted buying these strips because this lady has lost her pregnancy to preeclampsia. It was poorly managed. When she took in, her friend introduced her to Preggify, and we don't want to take any risk. From day one of that pregnancy, we started home care for her. We trained her to do her urinalysis at home, so she would do it, she will interpret, she will send it, and her doctor at Preggify will interpret. Another thing that we did was her blood pressure. She got her fig at home. She was monitoring her blood pressure. It's in morning and evening time. See the way she was doing it. She checked in the morning, she checked in the evening, she reports to her doctor. Why we do this is that if there is anything like preeclampsia, we are going to pick it first. Even if she has not gone to the hospital, her blood pressure is going to tell us that, oh, it's spiking. Is the drug working? When hospital give you BP medicine, you go home and you're taking it. The next time they will find out whether it's working is in 2 weeks' time or 1 month time. Something would have gone wrong. At Preggify, we make sure that daily we do this to make sure that the patient is responding to medication. Why we do urinalysis is that when preeclampsia wants to start, it's going to give us traces of protein in the urine. And instead of waiting for when she goes back to the hospital in 2 weeks or 3 weeks' time, we pick it at home. And once we pick it, we move her to the hospital or to a nearby laboratory to confirm if what she got was not contamination or it was a real protein. And then we quickly refer to the hospital and then we follow up. Okay. And for this woman that have lost her pregnancy before, look at her after 9 months. Look at her story. Now she's a mother. She's a mother today. And she said, and it ended in praise because Preggify was always there to listen and to make me take action that will benefit me when necessary. We don't we pamper, but when it comes to something that we know that you will do to keep you safe, we don't pamper anybody. We make you to do those things. We get you to do them because we know this is the only way for you not to repeat the story that has happened before. This is the only way for you not to even develop the complication. And if you develop the complication, this is the only way for the complication not to affect you or your baby. So you see why it always, affects me when I see women who lose their life. Like, why should you lose your life in pregnancy? It shouldn't be happening. I'm not saying that there are avoidable causes. There are avoidable situations where, women encounter very terrible situations and lose their life. But those things happen should happen once in a while. It's not something that we should be reading online every day. These are even the ones we read online. What of the ones that happen and people don't have the courage to share them? There's no reason for any woman to lose her life during pregnancy. These are women that have gone through Preggify. See, this lady at 6 weeks almost lost her pregnancy and she reached out and we did our thing and she had her baby. This is another woman that had preeclampsia. She had fibroid. When she came to Preggify, she was like, urinalysis. She said, it is here I heard what urinalysis is. Some situations I was saved from is from this group, Jerry. She goes for antenatal, but she has not heard about urinalysis. They didn't do it for her. She had preeclampsia, she had fibroid, and a lot of other complications. And today, this lady delivered December 2023. These are the testimonies that we have, a lot of them. Why am I sharing this testimony? Not to, brag, which we even have the right to brag, but to tell you that when you have the right care, when you have the right hands monitoring you, you shouldn't have any reason to have ugly experience in pregnancy. Okay, these things are preventable. I can keep sharing testimonials of these things. All right. And if you are still with me to this point, you will believe with me that the dates you have read online would have been something else. These women could have lived. These women and their babies could have lived if they had the right care. Okay, and this is why I'm inviting you to Preggify, where you have access to a doctor 247. There is no pressure when you come to Preggify. Nobody's telling you to wait before you see a doctor. You don't have to queue. You don't have to book appointments. You don't have to wait for 2 weeks. You don't have to wait for morning. Whether it is the midnight, morning, afternoon, whether you're in Nigeria, you're outside the country, vacation, at work, you can easily talk to a doctor at Preggify. You can easily review your test results at home. We can easily send you for test results, review it, and tell you when to move to the hospital. Apart from this, we hold weekly pregnancy classes that help to simplify pregnancy education for you. We also train you to do your test at home, review the test for you, identify if you're having complications, and help you to make informed choices. So, what are you going to do now? You're pregnant. Click the link that will pop up on this page to join Preggify today. Click the link, the second link you're going to see to join our women community. If you're pregnant or not pregnant, join our free women community where you share with other women, learn with them, and learn from their experiences. And if you want to talk with Dr. Ifunanya personally, use the link or this number you're seeing on my screen to chat me on WhatsApp. And I'm going to offer you 2 to 3 minutes free session, okay, to talk with me. Okay, we can't wait to show you how easier it gets during pregnancy. These are women that have been with us. These women cannot be wrong about the things that we have done. Like I said, pregnancy is not a death trap, it's not a death sentence. What you're not getting is the right care. What you're not getting is the right information. And what you're not getting is the fact that before you talk to a doctor or a midwife, you have to go to the hospital. So you resort to talking to other women or Googling things or using YouTube. Why you can actually have a platform, you can be sure that you are talking to a real doctor. You are talking to a real doctor. These are women that have been with us. Some of them are not in Nigeria. This Lillian is in Canada. Some of them are in UK, but they still use Preggify to be able to talk to a doctor. All right. What am I saying? Pregnancy is a beautiful journey and you deserve to live. Don't let ignorance, don't let poor access to care, don't let your work or your business be a hindrance, be something that will make you to tell a story of regret because you lost your baby, or make your family to live in regret because they lost you in pregnancy. You deserve to live and you must live with the right information and with the right care. I can't wait to see you, get pregnant, thrive in your pregnancy with Preggify. All right. Remember to click the link you're seeing on your screen that will pop up to join us today at Preggify. With a one-time fee of 50,000 naira, you'll be able to have access to a doctor throughout your pregnancy at Preggify, have weekly classes on pregnancy. 24 hours, you can talk to a doctor, whether it's in the nighttime or daytime, without restrictions. Training on how to do your test at home, test reviews, training of labor on how to achieve a vaginal birth earlier than your EDD. We monitor you through your delivery process, whether it is vaginal birth or cesarean section, up to 2 weeks after your delivery. And if you have complication, we monitor you up to 4 weeks after your delivery to make sure that you have recovered completely before leaving us. I can't wait to see you at Preggify, and I can't wait to see you in the community. And I hope that you live and you thrive. Okay, having the right care during pregnancy. Once again, I am Dr. Ifunanya, and I'm here to make your pregnancy journey easier and simpler using Preggify. See you inside.